Performing surgeries in low-resource settings and active war zones across 5 continents and 55 countries, Dr. Mallah has also collaborated with organizations such as the United Nations and the World Health Organization to eliminate barriers to people getting safe surgical care. Dr. Mallah of the Medical University of South Carolina joins us in this studio to talk about his commitment to global health. And we are so happy that you could join us, Dr. Mallah.
Thank you so much for having me.
Yeah, you talk about, and I encourage people to go back and read more about your history. You come from very humble upbringing. So I'm curious about what inspired you to your commitment to surgery and then ultimately global health.
Yeah, so I am an immigrant myself, and I grew up in the poor part of North Carolina, and now I'm a trauma surgeon. I think it really speaks to the American dream of what you can achieve. And so that's what inspired me. I think anybody can do it, and now to have this skill set, you got to use it to be able to impact people and change people's lives.
Talk about some of the kinds of work that you are doing here at the Medical University of South Carolina. You have traveled all over the world, literally, and are teaching people how to use the resources that you're able to train them to be able to do to help others.
I think the most inspiring part of my job is getting to work with the trainees. So having trainees come to our program, the Global Surgery Program at MUSC, and seeing them turn like the lights on, just getting lit up with what they can do if they apply themselves, it actually makes them better physicians, it makes them better global citizens, and it makes them better providers for patients here.
You have seen the worst kinds of conditions and able to overcome some of those obstacles. Can you describe some of what you've seen and how you're able to help people in terms that the average person who's not trained in this can understand?
Some of the things that I've seen, I'm still honestly working through myself.
Mm-hmm.
I've seen the worst parts of humanity, sadly. But again, going back to the young people and the trainees, that is healing for me. Watching them and seeing that they can create a better world for us in the future, that's what keeps me going, honestly.
People who are watching this report and listening to you, how can we support your efforts and also support these students who will be even better trained to work in other countries, but also to give care here?
Yeah, so I want the trainees, I want the students and the residents to be better than me. And so, unfortunately, that takes resources, it takes funding. And so I think people, if they want to support, can look at MUSC Global Surgery. But also just getting involved. Our events are open. People can come to our events. They can see it in real time. We're all over social media, and people can reach out to me directly. I'm happy to engage on this.
All right. Well, Dr. Mike Mallah, thank you so much for all the work that you are doing, not only here in our local community, but around the world.
Well,
we appreciate it. Thank you so much.
Thanks.
And of course, we want you to stay right here with us. We are coming right back with more news.